class. Today we're going to be looking at animal-assisted activities in therapy, chapter 29 in your book. The objectives we're looking for are to differentiate between animal-assisted therapy and pet-assisted therapy, therapeutic horseback riding, and hippotherapy. Describe the types of small and large animals that may be used during animal-assisted activities in therapy, and describe the role of service dogs. Also, discuss incorporating animals into pediatric OT practice. Some positive effects of animals on humans is that they decrease the social stress and increase social interactions. We need that more than ever today. It can improve the quality of life by increasing self-confidence and control over the environment, and improve cardiovascular health. I guess that's like when we get outside and run with our dogs, huh? It can increase trust. No one trusts you more than an animal, and we can definitely trust them. Also, it offers unconditional love. So some definitions for animal-assisted therapy is the specific treatment intervention to a patient that is designed to produce a specific goal. Animal-assisted activities is the casual meet and greet activities that involve pets or other animals trained for the purpose of visitation, such as going into the nursing homes. I see that a lot, where they'll bring a dog in and a group of patients are there and they pet the dog. Also, you'll see this on cancer wards with children's hospitals. Pet-assisted therapy is working with family pets in the therapeutic environment. So they bring their own animals in and you work with them. Assistant dogs helps the guardian with activities such as seeing, walking, and hearing. Therapy dogs help in a therapy setting. Service dogs, as my dog is sitting here looking at me. Police or search and rescue dogs, specific role for which they must be trained, and they sense the onset of a seizure. Several of these can be found on Facebook. I saw one where the lady was having a seizure and the dog literally got up under her to protect her head. A guide dog assists a person who has a visual impairment or is blind. The hearing dog assists a person who has a hearing impairment or is deaf. And then there are medical alert dogs, assist a person in a medical emergency by detecting physiologic changes and locating assistance during the emergency. So then there's types of animals. A mammal, which is warm-blooded with a backbone, such as small dogs, cats, rabbits, guinea pigs, and large ones such as horses, cows, and pigs. Reptiles, cold-blooded with coarse or horned outer covering. You know anybody like that? I do. Snakes, lizards, and alligators. Now, I'm not so sure I'd want one of those to be a pet, though. Then there's amphibians who are cold-blooded with smooth skin. Had a few boyfriends in my day like that. Those would be like frogs, toads, and salamanders. Fish, cold-blooded with gills, fins, scales, or skin, such as goldfish, betta fish, kissing fish. I would think maybe those would be more for anxiety type patients with anxiety, maybe watching them. I don't know how that would be more of a therapy animal, but invertebrates, they're cold-blooded without a backbone. Known several of those people too. There's like worms, snails, hermit crabs. Then large animals, farm animals, such reside on the tract of land being cultivated for food, such as horses, mules, pigs. Then there's exotic animals from somewhere outside the United States. Doubt we would see much of those, but possibly, and my daughter would really love the llamas. And then there's marine animals, mammals that live in the brackish waters. So some benefits of animal-assisted therapy. We have psychosocial benefits such as increase in verbal interaction and attention skills. It can help increase self-esteem and decrease depression. Social and motivational benefits include improved willingness to be involved in a group activity. Maybe A patient may be in a psychiatric setting and doesn't want to interact, but an animal comes in and they start interacting with the animal. So it does improve interactions and communication and cooperation. Physically, it could decrease blood pressure, stress, improve motor skills, and even educational skills. Equine-assisted therapy is the therapeutic use of horses for treating those with disabilities. Hippotherapy is a special form of equine-assisted therapy. It uses three-dimensional movement of the horse to achieve specific therapeutic goals. So therapeutic horseback riding would be equine-assisted activity that primarily focuses on the instruction of riding skills for individuals with disabilities. So there's a difference in therapeutic horseback riding and hippotherapy. The benefits of equine-assisted therapy: improves functioning in all areas of occupation by developing the following. It can improve muscle tone, balance and equilibrium responses, gross and fine motor coordination, symmetry, postural control, self-efficacy and self-concept, body awareness, emotional well-being, and a sense of control. So objectives for equine-assisted therapy and occupations: to improve the child's ability to engage in the occupation of the maintenance of horses, to participate in riding sessions, to groom and care for the horses, and participate in social activities and interactions. There's a North American Riding for the Handicapped Association. It promotes safe, professional, ethical, and therapeutic equine activities, provides education standards, certification of instructors and horses, and it promotes communication and research. So guiding questions for the use of animals in OT practice. So who would need animals or animal therapy? Where would it be used? What type of animal? What type of interaction are you looking for between the human and the animal? Are there some safety issues that we need to consider? Some goals and objectives? Can you think of some? So when you're intervention planning, you're using it can be used as a modality or a goal. So animal as a modality or tool, it would help to increase the range of motion in brushing a horse, for example. But if it was a goal, then it would be actually caring for the animal as an IADL. It can be both, or it can be either or. Emerging or expanding practice area. So unlimited potential to incorporate animals into pediatric interventions are possible. There's like an endless way that you can add animals to your therapy practices. There's opportunities to explore the environment, opportunities for acceptance and nurturing, opportunities for social interaction, and opportunities for interest, motivation, and belief in their skills. So there's all sorts of reasons to use animals in your practice. There are organizations that are concerned with human-animal interaction, such as the International Association of Human-Animal Interaction Organization, the Delta Society, and Assistance Dogs International. I suggest taking a look at some of those organizations and see how they fit in. And in summary, the use of animals can be creative and interesting modality for OT intervention, and children especially enjoy interactions with animals and occupations that involve them.